is Alejandro Hernandez. I'm from Spain. Before like two or 2.5 months, I had tibia surgery, and it's lengthening surgery, but at the same time it was also correction surgery, because I had the bone in my tibia. It wasn't just straight, I had bones, so the doctor correct that also, and I was planning to get like 5.5 centimeter, but I get 6.5 centimeter. I'm really happy with the results. So yesterday the doctor removed the external fixators from my tibia, and everything is just fine, no complication. It's just normal to have some little pain after the surgery, because everything is just fresh, but maybe after 5 days everything will disappear. It's just normal. You know, in Istanbul there's many different facility or doctors, they offer such a surgery, but I was looking the whole time such a doctor like Dr. Yuksel, and I want to thank the whole team, because it was really a very good journey with them. So Dr. Yuksel, he have really very good experience in lengthening surgery, and of course other surgery, correction and another thing. And he's really very nice doctor, and he do his job very well, and the result is really satisfying. So, and of course the whole team, everyone in the team, they are really very nice. I like them. They are now like my friends. I'm sad I will leave them, but it's just like that. And the physiotherapy, it's really very good to have, like every day, 5 days in the week, physiotherapy that's help you, and for example to provide the pain at night and to get more centimeter also. So the whole facility, let's say with the doctor, everything is just perfect. So because of that I choose them. I know many other doctors, and I have before that experience with other doctors. So that's my opinion. I find Dr. Yuksel is one from the best in Turkey. You can trust him with such a surgery, because this surgery, it's not easy. It's a long process, and someone should be professional to do such a surgery. I will be honest, and I will talk about my personal experience. The first 5 days in the hospital, I didn't have any pain, like zero pain. And of course you get painkiller, but as I know from other patients, like every person is different than the other. So I think if you do like sports, I mean, like every day your body is really strong, and so I think that pain level, it will be different between you and between the other people. So for me it was really easy. Starting from the first day I was walking, of course with walker, but I mean, you know, you get it's very hard surgery, but you start walking for the first day. And the second day I told them to stop the painkiller, so it was for me just fine. I didn't have that pain, it was just normal. And after 5 days I was in the hotel, starting immediately the next day with physiotherapy. There's little bit pain during the physiotherapy, it's just normal, because you had such surgery and everything just fresh, and they trying of course to help you. So there's some kind of pain. Of course you can get some painkiller before that. I didn't get painkiller, and it was just fine with me. And let's say during the whole process, it was like 2 months, or let's say 2 months and 1 week. I had pain really like just 2 nights. The other night I was sleeping like crazy, 10 hours, 12 hours, just normal, without anything. Maybe there's some people they had more pain, I don't know. I'm talking about my experience. So the last thing, the external fixator, to the removable of external fixator, it wasn't painful, but for example, I had little bit pain like in one from the tendons, but it was like maybe 4 or 5 hours, and it's now, for example, today it's just disappeared. And I asked the doctor says it's just fine, just normal, because the first 3-4 days, you know, it's also like, let's say, like small surgery. It should be some kind of pain, but it will be disappear. Now today I'm just fine, and I'm ready to go back to my homeland, to my life like a new person. It's just like that. For me, it wasn't hard really. I was the whole process. I was just do like everything. Just I like do it in the normal life. But you should prepare yourself before the surgery. It's such a thing. You need to be ready. You need to be because you will stay like, let's say, like 2 months in the hotel, like not alone. There's the whole team. They are here. And there's another patient, you can talk to them, you can do some kind of stuff together, but it's not like before the surgery. You are like free man, you do what you do in any time. As I say, for me it was just fine. Just maybe when you sleep, I didn't have any pain, but there's some people, because they have the devices in their legs, they still thinking to remove it as soon as possible. But such a thing happened with me just the last day before the removable surgery. The last day. I didn't think about anything the whole time. Just the last day, the last night, let's say, before the surgery, I was just thinking I want to remove that and I'm finished. And I think it was just fine with me. That's really a good question, because there's really something to do it, to prepare yourself for such a surgery, because you are, let's say, you are like just normal person, and suddenly you want to start from zero, which because you get such a surgery, it's not easy, and you walk, let's say, the whole day with a walker. So I think the best thing to do before the surgery, let's say 3 or 6 months, to visit the gym every day and to work hard on your body, your whole body. It's not just about your legs, your whole body, to work, to do really good kind of sport, and of course not to smoke. It's really bad. So because of that, I'm saying I didn't had a real pain, because I prepare myself. I was like, I visit the gym every single day, 8 months. So when I came, my body was really ready for such a surgery. So if you do that, I think you can be really ready for such a hard surgery.
Okay. Thank you very much.
You're welcome.